Good afternoon and welcome back to The Scoop. Besides me, I have my father, Luke Hirata. He's a charge nurse at St. Clair Hospital with a strong history of not only working at St. Clair, but at multiple different locations and different settings. Whether it's in the city or in the Navy, he has a lot of experience with working in the emergency room, but also working with teenagers and sports-related injuries that we'll learn about today. So, Edward Hirata, or father as I may say,
Thanks.
how did you get into nursing?
Well, it's been sort of a long journey. My mom was a nurse, my dad was a teacher, and because at the time school wasn't really my strong point, I thought, and the kids from the neighborhood would always come over, and my mom would look at their bumps and bruises and take care of them. I sort of was indoctrinated into it, if you will. I also, during my freshman to junior year in high school, I volunteered on a physical rehab unit in Philadelphia.
Did your mom work in that?
No, she was a school nurse, but she did actually volunteer at the same hospital,
Okay.
Thomas Jefferson in Philadelphia. So I decided that because I wanted to maybe be a physical therapist, that I would volunteer on a physical therapy unit. Unfortunately, after a couple days of being in physical therapy, I really didn't think it was for me. But what was for me was the nursing and what they were doing, the procedures, the on-hand care.
Right. Yeah.
So that really is what started the drive in me to become a nurse.
Why wasn't physical therapy like your fancy at the time?
Well, it's just, for me, it was a lot of range of motion of the patients that, and it seemed sort of tedious, and that really wasn't for me. Whereas I was more interested in doing a lot of the procedures.
Yeah, it seems like working in the ER is more on hand at the time, like in the moment type of stuff, where physical therapy is more rehab and rehabilitation and stuff like that.
Right.
So you kind of have a better feel for what's going on in the emergency room, right?
Oh yeah, absolutely. I mean, at the time, I didn't realize that. I got a liking for that later on when I was in the Navy.
What other jobs did you do before your current job right now, and what were those like?
When I joined the Navy, I was a corpsman there, and that's sort of like a medic, or they actually perform the duties of nurses as well as physician's assistants. Mm-hmm. And while if you're not deployed with a typical unit on an operation, then you have a job to do on base, and mine was the emergency room.
What did you see in the emergency room there?
A lot of like physical endurance kind of injuries, where stress fractures from the Marines, that sort of thing. A lot of physical injuries, athletic injuries, that sort of thing.
And then earlier before this, we were talking about you were working, where were you say, in New Jersey?
Yeah, well, I volunteered until I started going to school at Hahnemann University, and then I wasn't really sure that nursing was for me at that point.
What were your other options?
Well, I could hang around my parents' house and
just sit around,
get a part-time job and go to school part-time. But I decided, maybe I ought to just search things out. So that's why I decided to join the Navy.
And did you work in an emergency room in the city?
Yeah, later on. After I got my nursing degree, after coming out of the military, I went to work at the hospital at University of Pennsylvania.
What was it like working there?
Well, I worked a lot in their trauma unit, and it's very fast-paced, and you see an awful lot.
What kind of things do you see in the ER there?
A lot of motor vehicle crashes, injuries caused by violence, that sort of thing.
And these weren't more of like formal sports. These were more backyard type of sports, more like on the court.
Well, yeah. Unfortunately, we didn't see a lot of direct sports-related injuries. We saw injuries related from betting on sports, that somebody tried to welch on their bet. And then violence ensued, and then we would have to take care of them.
And now you currently work at St. Clair Hospital, which
Correct.
is, where is that located at? It's in...
It's in Mount Lebanon.
Okay. And how is that different from working in Pittsburgh, working in Philly? What is the difference?
Well, the hospital itself is different. I mean, it's, St. Clair is a community hospital that serves sort of a larger part of the South Hills, whereas the University of Penn, they serve even a larger community with helicopters coming in and that sort of thing from the outskirts of Philadelphia. Wow. With trauma patients. And of course, St. Clair isn't a trauma unit, they're a local hospital, community hospital. So,
Do you enjoy working in the ER, and why?
Absolutely do. Emergency nursing is very fast-paced, it's very dynamic, it's very chaotic at times, and you have to like that sort of thing. You could have maybe a couple hours where you're not doing anything, and then everything explodes.
And you work the night shifts, right?
Correct, always.
What is the difference between working in the day versus working the night? Because I know you probably have some experience with working in the day.
Yes. I really enjoy working at night. We are a tighter knit team, and everyone helps everybody else. It's almost like working aboard a ship where everybody relies on everybody else, and everybody has to know everybody else's job because you need to accomplish the objective with a smaller amount of people and smaller amount of resources.
What's it like working at night? Is it ever tiring?
Oh,
Do you
yeah,
ever
absolutely.
Feel like
Absolutely. You never
feel like you're just like kind of dozing off?
Well, when that happens, there is always other distractions. If it's slower, we have to restock and get the emergency room ready for the next day. And we also will do some educational teaching during the night shift and just commiserating with your other teammates.
What kind of cases do you see in the night?
Really anything, abdominal pains, people that get up in the middle of the night and trip and fall, really it can be anything.
Is that all ages that usually trip and fall?
Yes.
I feel like that's more like aimed towards the older people whenever they try to get up.
Sometimes, yeah, but it's not exclusive to them. It can be younger people too that trip over a dog or something that they've left on the floor, or that sort of thing.
What's the most stressful thing you've seen in the ER?
Well, I mean, whenever someone goes into a cardiac arrest where their heart would stop in the middle of the night, I mean, that's always stressful, because you want to save this person and do the best job as possible.
Can you possibly run through what it's a night in the ER for you?
Well, check in. Well, being a charge nurse, I have to make sure that the staffing is appropriate. I go around and make sure my people have everything they need to perform their jobs to take care of the patients. So,
that's actually really interesting. And now, I feel like one of the biggest discussions right now is between either concussions or more sports-related injuries. What is that? What are your feelings on that?
Well, I think with all the regulations that have been placed on some of the sporting events and that sort of thing, I think that we see less injuries than we would have several years ago. I think there's better equipment. Unfortunately, we see that adolescents these days are bigger in mass than what they were several years ago.
The harder they fall.
Correct. And so a lot of energy is produced, and despite the fact of having top-level equipment and safety precautions, people still get hurt.
What injuries usually come with what sports?
In football, of course, we see some neck injuries, wrist injuries, ankle injuries, head injuries. That's really covers the gamut. One night I looked out into our waiting room and I saw almost every sports uniform represented there.
Can you run through that for me?
I saw hockey. There we see some lacerations from skate blades. We also see a lot of head injuries there. Basketball, we see a lot of concussion or head injuries, a lot of eyebrow lacerations. Football, as I said, ankle, wrist, neck, head.
Is there anything in the ER that you guys don't cover? Like, do you guys have to send out to either a trauma center or
Yeah,
any type of stuff?
absolutely. Absolutely. Sometimes people don't realize how injured they are. But once we get a preliminary workup on them, we realize that they've suffered a more traumatic injury, and which would be better handled down in the city.
Do you ever feel like people come into the ER when it's completely unnecessary?
All the time.
Well,
All
can you
the
explain
time.
like how?
Unfortunately, in our society, it's a very easy. We want easy gratification. We want it now. And when your family physician says, "Well, I'll see you in a month," that's not going to work for most people. So they would like to come to the ER, make sure that nothing is seriously wrong with them.
What types of cases usually come in? What do you usually see?
We see a lot of chest pain, a lot of abdominal pain, a lot of prolonged injuries that occurred quite some time ago. But
I mean, especially with this past holiday, what did you see during the Christmas time?
a lot of abdominal pain from overindulgence and a lot of lacerations, that sort of thing.
And Thanksgiving from the
cutting
turkey.
up food and that's yeah.
That seems like a lot of people have been trying to fry their turkeys. It's weird.
Yeah, luckily we haven't seen any of those injuries.
That's pretty great. But more going towards sports, do you guys do any, do you guys do stitches? Do you guys do all that stuff?
Oh, yeah.
What can we tell the audience to come in for rather than not to come in for? Like, what should we come in for and what should we not come in for to the ER?
Well, I mean, anytime you get injured in sports, I think it's probably one of the more prominent safety regulations that you're going to have to be seen, no matter how insignificant the injury is. So in that case, we would see you in our fast track services more than likely, and we'd go from there.
Do you enjoy your job working in the ER? Like seeing all these sports cases?
Yeah. Well, I mean, sports-related injuries, general population injuries, or illness. I mean, we see it all. We cover it all.
What's some of your favorite things that you enjoy about working in the ER?
As I said before, the teamwork amongst the staff. And in my job, I've sort of not gotten away from patient care. I still do patient care, but I've gotten, being in charge, I take care of the staff so that they can take care of the people and make sure that they have everything they need to perform their jobs well.
Okay. Well, thank you guys very much. We're going to have a 2-minute break here for a little bit, and then once we come back, we're going to talk more about what's it like to deal with sports in the ER. Thank you very much.
Together, we can change the news. Find out how at safekids.org.
Welcome back, everyone. My name is Luke Hirata, and besides me, I still have my father, Mr. Edward Hirata. And we just talked about his background as a charge nurse in the ER, and now we're going to be talking more about sports and, in detail, how to talk and deal with sports. So, can you tell me what it's like to deal with a concussion that comes into the ER? How do you deal with that?
Yeah, well, when somebody suffers a head injury, sometimes there are different grades of concussion where it can be less serious, meaning that they don't really recall when they were hit, but they know everything up to that point and afterwards. The other more serious sort of concussions are when they can't remember what was told to them 5 minutes before, and they keep asking what happened. And so that would be a more serious head injury.
What do you usually tell these patients?
Well, we usually get some diagnostics on them, head CT or a CAT scan of their head to make sure that there are no fractures or bleeding within the brain. We usually refer them to the impact testing, which most sports people will already have had a baseline impact testing so that they can compare the results after the injury to the before the injury.
Other than head, like other injuries we talked about earlier, but what are the more serious injuries that you see from sports?
Well, as I said, some of the equipment has been better developed, but we do still see internal injuries, cardiac contusions or bruises to the heart, lacerated spleens or a cut within the spleen, which may cause some bleeding, some abdominal trauma, neck injuries.
Wow.
So, yeah, so, I mean, despite all the advances in the equipment and the regulations, we still see a fair number of injuries.
How do you usually help these people recover? Is it usually a long recovery time?
Well, it all depends. I mean, with head injuries, yes, usually the recovery time requires some downtime from sports and from all activities that cause any sort of stimulation. Your computer work, playing on your phone,
Do those
TV,
usually prolong?
They can aggravate the situation. What they want is the brain to rest and not to have a whole lot of sensory stimulation.
Are these really common to see in the ER, all these types of cases?
Yes, we see them because sports go on for all seasons. We see every kind of sports-related injury all year long.
What's really the difference from the past whenever all the equipment wasn't so developed to when it is now?
Well, of course, you know, we would see more serious injuries. A lot more people would have to be transported down to the city for more serious trauma. Nowadays, we can pretty much discharge them and have a follow-up.
So they're not as serious. It's more of just like, here's what's happened and now you can go. It's not as like...
Yeah, with more or less a follow-up with either impact testing, depending on the injury, of course. If it's a head injury, it'll be impact testing. If it's orthopedic injury, they'll follow up with orthopedic doctors, which a lot of sports people already have a relationship established with an orthopedic doctor.
So do they usually go there?
If it's bone-related or, you know, that sort of thing, a fracture.
With this winter time, what do you usually see from all these types of injuries?
You mean during the winter?
Yeah.
A lot of hockey, which is blunt force trauma when shoved up against the boards, knocked down to the ice. We see a lot of lacerations caused by skate blades, from also getting hit with a puck. I've seen that too. So,
what advice could you tell these athletes?
Really, I mean, in the heat of the moment, when you're playing sports, I think that's not really even a consideration, playing safe. I think a lot of adolescents are determined to reach the goal, so to speak. So it's an afterthought.
So you should just tell them next time, just do this, like try to take it a little less harsh, I guess you could say.
You can tell them that. Whether people actually listen to you or not is a totally different story. So.
Okay, that's really interesting. What's like more of a common type of thing you see in the ER? What type of injuries do you usually see, other than sports?
We see a lot of motor vehicle crashes, especially during the spring, because people, it's the warmer weather, they're thinking, what am I going to do when I get home? And then they're not thinking and they slam into the back of somebody. So they know what they're going to do then when they're going to be going to the emergency room for an evaluation.
I don't know how you deal with this type of stress sometimes at night. What's like the hardest thing for you as a nurse?
Well, you know, you deal with stress through, in the ER, a lot of humor. There's a lot of joking around and that sort of thing. And I think that reduces the stress a lot. That, and whenever we can, we try to have celebrations for birthdays and holidays, and by bringing in food and that sort of thing. So.
Oh, that's cool. What's your favorite part about working in the ER?
Just the dynamic sort of environment that you have to work in. You never know what's coming in. It could be an actual routine sort of night where you may get a couple cases here and there, nothing too serious or emergent. And then other nights you're constantly going from the time you get there to the time you leave.
What's like a normal night for you then?
A normal night would be basically people coming in 3, 4 at a time, either being admitted or discharged, and everything's sort of not really overwhelming.
Compared to like more stressful nights that are more...
Yeah, it's been pretty stressful since the flu season began.
Really?
Because you have a lot of people coming in with influenza. And
why does this usually happen? Like what can you kind of run through why the flu is such a big problem right now?
Well, right now, I mean, unfortunately, they didn't get the vaccination right. So as we've all heard on the media, and it's only 10 to, I think, 30% effective. So we have a lot of people coming in with just symptoms of the flu and just feeling miserable, and they just want to feel better.
How do we deal with this? Like, is there a way to prevent it?
Just really prevention is getting the flu shot, because it still provides some benefit, especially if you're older or you have other illnesses going on.
Is this usually affecting our sports? Like, do you think that the flu is really taking an impact on sports too?
Yeah, it probably will. I mean, a lot of the younger folk, if they come down with the flu, they're obviously not going to be able to play sports or go to school. So two things are affected there. Just like the workforce is affected. A lot of people can't go to work, and they're laid up for several days. So
how should we kind of treat this?
Really, to be preventative, not only in getting your flu shot, but also to get plenty of rest. I mean, a lot of people, they just don't rest these days. They're constantly going. This is our society. And we're staying up. I always say we stay up way too late at night, playing on phones, watching TV, on the computer. Really, people should be getting the rest they need.
But okay, how do you guys deal with this in the ER then? If someone comes in with the flu?
We basically just try to make them feel better. There's not a whole lot we can do for it. If it's been past 72 hours, the medicine that we give really isn't all that effective. We try to give them fluids. And
does this spread throughout the ER, all this flu
Oh
stuff?
yeah, our own staff come down with it a lot. We've had several members call off this past week just for flu-like symptoms.
Wow, really? That's actually really cool. But I kind of want to go back to the topic of sports, because we were kind of running short on time.
Okay.
So can you tell me how you guys work together as a team? Because you were really telling me about like working on a ship. How do you guys work together whenever someone comes into the ER?
Well, normally they'll be announced to a room by our intake nurse, and the intake nurse will determine how serious that patient is. So if we hear an acuity 2, that's sort of serious. So everybody sort of goes into that room, performs the duties that they know how to perform, and they work like a team. And whatever duty isn't being performed, somebody will pick that duty up.
How does an acuity 2 change? Like, how does that differ from a normal type of?
Well, there's an acuity 1 that is basically your heart is stopped, and we need to get in there immediately. Acuity 2 is still serious, and everybody goes in there. Acuity 3 is pretty much what everybody is when they come in with their abdominal pains, flu symptoms.
So it's kind of like a level of like seriousness.
Correct.
In a way.
And acuity 4, of course, is like a fast track or like a minute clinic type Med Express type injury.
Do you usually see like acuity 1s and 2s with sports injuries?
Some acuity 2s, not really in acuity 1, but in acuity 2, yes. As I said, when you have somebody who's had some blunt force trauma to the abdominal area or chest area, that's always serious. So,
what do you guys usually do in that type of situation if we have a hypothetical situation?
We usually put in some IVs and get some lab work going, and if it's a chest trauma, we get an EKG, which shows your heart rhythm, and then we whisk you off to CAT scan to see what internal injuries you may have suffered during your sports.
And I mean, you definitely see so many of these types of sports cases with teenagers. Do you kind of include your nurse life with your actual kids and how you treat them?
Yeah, unfortunately, most ER nurses will tell their own children just to suck it up because there's nothing wrong.
I wonder how I know that.
Yeah, I was going to say, as you know, firsthand.
That's really cool. So we're kind of running low on time. So thank you everyone for today, and thank you, Mr. Hirata, or Dad,
Thanks for having me.
informing us about the experience you have with not only people and what to do in certain situations and how to prevent them. And thank you to everyone for watching The Scoop. Goodbye.